Sanibonani nonke, igama lami uZakithi Mkhize, imina uBlackGirlScientist and ngiyakwamukela kwi-channel yami. Uma uqala ukufika la ekhaya, ngicela ucofoze leyo button ebhalwe ukuthi subscribe, kumahhala ukusubscriber and khona nawe uzokwazi ukujoina lo mndeni futhi ukwazi ukuthi ngi-uploada nini ama-video amasha. If uyabuya, ngiyakwamukela back to my channel. So today, as the title suggests, I've decided to shoot a coronavirus series. There's been a lot of talk specifically about coronavirus vaccine because that's everything the world is talking about right now. There have been several vaccines that have been developed against coronavirus, and that will help us to achieve herd immunity. Don't worry, I'll be explaining all these words in my video, as well as curb the spread of coronavirus. So in this video particularly, I'm going to be focusing on vaccines, and also something new that I'm bringing to the channel is that I'm going to be doing this video in vernac. So I'm going to be using my own mother tongue as well, which is IsiZulu, to explain certain things and certain concepts. So the reason for this is because of the audience of my channel. I created this channel for young people, especially young Black people in my country, and I really want you to understand and grasp concepts, and I hope by doing this that you're able to, and that it will also expand my reach. So if you're ready to hear all about coronavirus vaccines, keep watching. Njengoba ngishilo namhlanje sobe sikhuluma ngama coronavirus vaccine. Njengoba bese ngishilo igama lami uZakithi, uma uqala ukufika la ekhaya and awungazi, ngisacela uyobukela amanye ama video ambandla. Khona ama video la ngichaza mina ukuthi ngibani futhi ngenzani, and basically kafushane nje imina ngingu so science ngenza imfundo specifically on viruses, njengoba i-coronavirus i-virus nayo, kodwa mina kakhulu ngicwaninga isandulela ngculazi and ngenza i-PhD yami. So yeah, that's basically a little bit about me if you're new here in Zulu. So namhlanje sobe sikhuluma ngama coronavirus vaccines. As I've mentioned before, what really sparked this idea to shoot this video is because of course of everything that's been in the media. I want to make this as simple as possible for you to understand. I also would like to disclaim that I am not a coronavirus expert. I'm not a coronavirus vaccine expert. I am just doing this video as a simple, basic kind of breakdown of coronavirus vaccines and kind of debunking myths, as well as putting you at ease at what is happening with the coronavirus vaccine, when we're going to receive it, and things like that. So I really would just like you to keep that disclaimer at the back of your head. If there's any questions that you have, of course, feel free to leave me a comment down in the comment section below. But I urge you, especially during this time, to don't believe everything that you read, especially check out the source. Make sure that everything that you read is from a reliable source. I'm not talking about WhatsApp chain messages. There is a reliable source. And make sure that you bring out a little bit of the scientist in yourself and question everything that you read. And yeah, I'll be very, very proud of you being inquisitive and a scientist and not believing everything that you read. So bengifuna uqala ukuthi sikephi nge-coronavirus since the start of the pandemic. So since March 2019, what has been happening, how far have we come, and what are the numbers? I think first things first, let's look at the numbers. So since the start of the pandemic, worldwide there have been 88.1 million cases of coronavirus. 49.1 million have recovered, and there have been 1.9 million deaths. So I guess we're seeing and look at the results la in Africa. Sorry, not the results, the statistics here in South Africa. So in South Africa, there have been 1.17 million cases, 938,000 recoveries, and 31,809 deaths. I think just yesterday there were just under 21,000 new cases. The numbers keep growing and growing of new cases since the start of the pandemic, as of course we are now experiencing our second wave, which means that there has been a second surge in coronavirus infections daily. So now, as I said, this video is going to be focusing on the coronavirus vaccines and the different types of vaccines. I won't go into the different types as in from different companies, which one South Africa is going to be using, or which company South Africa is currently negotiating with. And this source of this is from the vaccine rollout strategy, which was given by Dr. ZULU on the 3rd of January. And then just talking a little bit about that, like I said, I want it to be super simple, and I'm not going to be talking too much about the types of viruses. Sorry, not type of viruses, the type of vaccines, because they're different type. They're mRNA vaccines, they're protein vaccines, etc. I'm not going to be going into that detail. So what is a vaccine? Yini vaccine. A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. So vaccine into esithathayo singakayitholi lelo gciwane. So into ekuvikelayo ukuthi ulithole lelo gciwane. That is what a vaccine is. So sesithathile vaccine ke manje, what happens next? What happens after you get vaccinated? Basically, what a vaccine does is that it stimulates your immune system to produce antibodies as if you were exposed to that virus, and then you develop immunity to that disease without actually having to get the disease first. So after you get vaccinated, umzimba wakho wakha amasosha ukuthi ngempela masusu bhekene naleli gciwane selingena emzimbeni wakho, umzimba wakho ukwazi ukuthi ulwe nale virus ukuthi ungaguli. Ilokho kwenzekayo ke emva ukuthi uthole i-vaccine. I-vaccine into right, i-vaccine into edingakalayo, njengawazi nje ingane ezincane zizelwe ngoba wona amasosha omzimba suke asadekenteka sawiki, bayawathatha ama-vaccine ukuze mabehlangana nalamagciwane wonke lawa semhlabeni, umzimba wabo omncane uyakwazi ukuthi uyivikele ukuthi ungaguli. So that is what a vaccine is in a nutshell. So I know that previously we've heard of this word herd immunity. So I'm first of all going to explain what is herd immunity. Herd immunity is when most of the population is immune to an infectious disease, and this provides immunity of a herd. So just like as you think of a herd of cattle, if most of the cattle is immune to a certain disease, the rest of the cattle is not going to get sick, which means that entire herd is immune kind of to that virus. So as Dr. Mkhize said in his address, in order for us to achieve herd immunity, we need to have vaccinated approximately 67 to 70% of the population. So that is, for example, if 80% of the population is immune, that means 4 out of every 5 people who encounter the disease will not get sick. So that's the same example that I use with the herd of cattle. If most of the herd of the cattle is immune, when they come across the virus, they will not get sick. That is what herd immunity is. And for South Africa, we are aiming for immunizing 67% of the population. I know you've heard this word before, and it was actually said before that Sweden was one of the countries that, didn't go on a hard lockdown and things like that in order to achieve herd immunity. I'm not quite sure if that was the right terminology to use, because I don't think herd immunity can be achieved without the presence of a vaccine, because you need to have had a majority of the population immune to a particular disease in order to protect the rest of the population. So leli gama lithi herd immunity lichaza ukuthi iningi labantu la eNingizimu Afrika abakwazi ukugula uma bebhekene ne-coronavirus, or uma behlangana nayo ingene emzimbeni wabo ngeke bagule. So to achieve le herd immunity funa senze isiqiniseko ukuthi iningi le population iyayithola le vaccine, njengoba eshilo uDr Zweli Mkhize kwi vaccine strategy address yakhe ngomhla ka-3 January ushilo ukuthi sidinga uku-vaccinate u-67% we-population at least, ukuze sazi ukuthi abantu abaningi ngisho behlangane ne-coronavirus ngeke bagule. So asikhulume ngama COVID-19 vaccines. Njengoba bengishilo kule video, since the start of the pandemic kunama vaccine over 200 abe khona in the experimental phase. Ngokusho lokhu sichaza ukuthi elab nje abantu abazama ukucwaninga ngama vaccine abasebenza ama vaccine awu over 200 emhlabeni jikelele. Kulo 200 awu 6 atholakele ukuthi ngempela ayasebenza kwi-phase esibiza ngama clinical trials. So ngizokhuluma ngawo 3 na, particularly i-Pfizer lesiyazi le biotech 95% effective, Moderna 94% effective, ne AstraZeneca 70% effective. So what I've just explained now is the different COVID-19 vaccines, that they've been over 200 in the experimental phase, and 6 vaccines which have been found to be efficacious in clinical trials. And I just mentioned 3, which is the Pfizer, the Moderna, and the AstraZeneca. So with South Africa's vaccine rollout strategy, because these vaccines have different storage conditions, in the 2 that I first mentioned, which is the Pfizer and Moderna, they need to be kept at ultra cool temperatures. So this is, I think they said -70, but I know in the lab we have -80 ultra freezers. These are huge freezers that are extremely cold and also extremely expensive, and this is a limitation, of course, for a resource limited country like South Africa, and we're a developing country, for us to obtain these diseases, because we simply do not have all these ultra bio freezers. We cannot afford to buy them as well. So a promising candidate, as also Dr. Zweli Mkhize said, is not even a promising candidate, the vaccine that we're actually going to get is the AstraZeneca, which is 70% efficacious but can be kept at fridge temperature. So I think it's 2 to 6 degrees, but it can be kept, your average fridge is about 4 degrees. So that's why we will not probably be getting a lot of Pfizer vaccines and more of the Astra vaccines, which are 70% efficacious. So side effects, I know this has been also a major source for uncertainty and unrest in these COVID-19 vaccines. There have been crazy stories all over the internet, and this, again, I'd like to say that please read the source of everything that you read. Do your own research, ignite the little scientist in you as well, and don't just believe everything that you read. Do not read things at face value and just absorb them like that, and then over and above that, you go and you spread that information, and that's what causes so much anxiety, unrest, and it's really spreading incorrect information. So please be careful with that. Side effects in vaccines is normal. Since vaccines were produced and invented, a side effect of a vaccine is normal. Coronavirus vaccines have been said to have mild side effects, as all do vaccines. Headache, they can be muscle tension and fatigue. Of course, there have been some extreme cases which have been reported, but those cases are extremely rare, and they are specific to that person. For example, if you take a vaccine and you have an allergy to an ingredient that's in that vaccine, and of course you may not know that, you will react to that vaccine, unfortunately. But like I said, these cases are extremely rare and occur in like less than 1% of the population. So please, if you see a report of an adverse effect from the vaccine, it's normal. It's not any cause for alarm. Of course, because the vaccine, people still have a whole lot of unrest because the vaccine was produced so quickly, but never in the history of the world has there been so many people and so much money injected into finding a vaccine, and that is why the time that it was taken to produce this vaccine was absolutely expedited, and it is the shortest, known in history. But this does not mean that it is not safe, that it is not effective. These vaccines have gone through vigorous trials, and the fact that they are now on the market and people have taken their vaccines and are taking the vaccines and are still going to take the vaccines means that they are safe. So I just want to put you at ease by saying that. So ngokusho ukuthi lama vaccine e-COVID-19 njengoba sefikile, abanye abantu abaningi banokungabaza ukuthi bazoyithatha noma ngeke bayithathe le vaccine. Mina nje engithanda ukusho ukuthi ama vaccine asafe, ngeke azawenze lutho. Lezi itori esizwayo ukuthi khona abantu abanama side effects, konke lokho vele into ejwayelekile, kodwa into engenzeki njalo, njengoba bengisho ukuthi into eyenzeka kwi-population yethu less than 1% abantu bazoba nalawo ma effect. So le vaccine esoyithatha isafe, iyasebenza, iyadingakala ukuthi sikwazi uku-achieve leli gama ebengisho ebengilichaza elithi i-herd immunity. I-vaccine iyona ngempela ezoqeda le pandemic esikuyo manje. So ilokho bengifuna ukusho ngama side effects ukuthi into ejwayelekile, into enzakalayo vele. Lokho akusho ukuthi ngoba i-vaccine yenziwe ngesikhathi esincane, u-2021 manje akukaze la emhlabeni ukuthi wonke umuntu kwi-pandemic usebenza ngokuthola i-vaccine. Futhi manje i-technology yethu advance ngalendlela nje ukuthi siyakwazi ukuproduce lama vaccine. Lama vaccine atestiwe, njengoba wonke ama vaccine atestwa kakhulu ukuze akwazi ukuthi afike kuthina futhi abe right, abe safe, angasigulisi nezinto enjalo. So please, i-COVID-19 vaccine right, is safe, it's effective. So the major question that people have, right now is to vaccinate or not to vaccinate. And like I said before, the only way we're going to achieve herd immunity is to vaccinate. That is the only way we're going to do it. And to achieve herd immunity, we need 67% of the population vaccinated. That is the majority of the population, and we really need everyone to be on board. And nobody is trying to kill you or trying to put a tracker in you and all these crazy stories that I've been hearing. This vaccine is safe, and it is what we need in order to end this pandemic, and I know that is what we all want to see. So that brings me to the end of the video. If video sengiyayiqeda ke lana, uma enjoyile le video, please go ahead and give it a thumbs up. If you're not already subscribed to my channel, please go ahead and subscribe. So I'm going to be doing this coronavirus as a series. In my next video, I'm going to be debunking a lot of myths around coronavirus now that I've heard as of late. Of course, as things in the media change, I will try to keep you updated in the basic way possible. And of course, if there's any topic that you want me to talk about specifically, please leave me a comment in the comment section down below. If you also enjoyed me explaining some things in Zulu in this video, please give me a comment down below. I really did try. It's so difficult to explain things in Zulu, especially scientific terms, and scientific ideas and things like that. But I will get better, and if you enjoyed that, please leave me a comment down below. And thank you so much for tuning in. I will see you on the next video. Bye.